Hello, and welcome to the SUSLA Safe Return to Work training sessions. We are here today with our healthcare providers who will be providing some information to you about safely returning to work in light of the presence of COVID-19 in our environment. And so the information that they share today will provide you all with the facts. And it's so important that we get the facts so that we can understand how to properly face this coronavirus so that as we begin transitioning back to work, each of you can feel safe and actually be safe. There are a number of things that we're doing here on the SUSLA campus, and we hope that as you transition and our students transition, that everyone will be in an environment that is safe. So I look forward to seeing you back on campus. Thank you and enjoy the session.
Good morning, Southern University Shreveport family. On behalf of Chancellor Ellis, I want to welcome you to our series of Safe Return to Campus. This morning I'll be sharing with you some of the highlights and procedures that we have initiated here at Southern University Shreveport. This morning we have the honor of having our second health partner, Willis Knighton, who will speak to you in reference to the coronavirus and safe return to campus. And what I'll do is, again, share some of our procedures that we have put together this morning that we think will be helpful in your safe return to campus. I want to thank my team, the facilities and university police, on behalf of all the work that they've done up to this point and that they continue to do. And as I go through these slides, we'll have questions at the end that several members of our audience will ask, and we welcome you to enjoy this video and reach out to us with any questions you may have. In our safe return to campus, our procedures will start with 3 checkpoints. The 3 checkpoints will be at the administration building, the new classroom building, and the Jackson building here on the main campus. At the Metro, it will be in the rear entrance. We follow the same procedures at each checkpoint. Your temperature will be taken along with a questionnaire that you will have to answer. Upon successful answering of those questions and an accurate temperature, you will be given a wristband to enter into the facility. Also, we have sanitizer stations set up. You should see those at each entrance, before the elevators, and throughout the campus, especially in our common areas that we share with our faculty, staff, and students. We have disinfectant wipe stations. Those are located in our labs and in our large classrooms. That's so students, faculty, and staff can wipe down their area before and after as an additional measure of health and safety. You will see personal protection shields throughout the campus. Those are located in the classrooms. They're also located in our common areas, being financial aid, the registrar's office, as well as in the IT computer room. Each classroom and each room should have a room capacity sign, which alerts UPD, who will be monitoring these rooms, with the maximum capacity of each room. Also, as an additional measure, we've hired a health floater. That health floater is someone who travels throughout the campus, going from building to building, sanitizing and disinfecting common areas such as stairwells, door handles, any touch points that students, faculty, and staff and visitors may touch. And that person will roam the campus continuously each day to ensure that we have a health and safe environment. We've also have a third-party contractor that we have hired since March, since the beginning of the pandemic, who comes out to the campus and disinfects the campus with EPA-approved COVID-19 disinfectant. That health partner is very diligent in their efforts and assures us through the EPA that our campus is safe for return. The last thing I want to say is mask up SU. Remember, we have procedures in place where everyone must wear a mask who enters into our campus, into the common areas as well. Again, University Police is on staff to ensure that everyone stays safe and that they're wearing a mask And on behalf of Chancellor Ellis, I want to welcome you back to campus, and we'll share more information from our health partner, Willis Knighton, who will be speaking here shortly. Thank you so much.
Good morning. I'm going to take my mask off, and I'll explain why. The federal and state guidelines for wearing a mask state that if you're giving a presentation to a group of people, and in that group of people there might be persons who are hearing impaired, you can remove your mask for that presentation. So normally I would not take my mask off when I'm in a group of people, but for this kind of an event, I think it's helpful that you can see my face. My name is Lisa Stamper. I'm the Director of Infection Prevention at Willis Knighton Health System. I've been at Willis Knighton for greater than 30 years, and I've been in infection prevention at Willis Knighton for greater than 15 years. Willis Knighton is proud to partner with our local schools and other businesses throughout the community to help us return to normal or semi-normal activities during this COVID crisis. This is a giant public health emergency. It is ongoing. Nobody has any idea when this is going to resolve itself, so we have to keep providing the correct information that's based on science from the Office of Public Health, the CDC, the World Health Organization, so that we can protect everyone, the community, healthcare providers, students, grandparents, nursing home residents. It is a partnership amongst our community, and I think we're doing a great job so far. I'm going to start with a little information about COVID-19. My slide says, first, don't panic. You hear a lot in the media about, oh my God, there's a problem with COVID at this nursing home, or there's a problem with COVID at this hospital. Try not to listen to the media hype with regard to COVID. There's a lot of science out there, and we are taking advantage of that. COVID-19. COVID is spread by respiratory droplets. When people talk, cough, sneeze, laugh, and sing, droplets are coming out of your mouth, whether you know it or not. I'm sure you've seen those photographs that shows the dispersal of droplets when someone sneezes. Those are respiratory droplets. They travel through the air for several feet, and then they're heavy, so they fall to the ground. So that is the reason you need a mask on. When you're interacting with other people, when you're within 6 feet of other people, you need a face covering face mask. What that does is, I have on a mask and you have on a mask, the droplets cannot permeate your mask and my mask, and particularly if you're social distancing. If I'm 6 feet away from you, I have on a mask and you have on one, we're both protected against those respiratory droplets. The longer you interact with other people, within 6 feet of other people, without a mask, the more opportunity you have to inhale those respiratory droplets. Masking is vital to protection of everybody in our community. There's no cure for COVID. COVID's a virus. Of course, the CDC and the World Health Organization and everybody else is working on a virus. We don't have one yet. A vaccine. We don't have one yet. If you get COVID, you have to deal with the COVID symptoms. You may have a serious case of COVID, you may not. You may have a very mild case of COVID. But there's no vaccine at this time to give you to prevent you from getting COVID. Antibiotics are not effective for the treatment of COVID. Antibiotics do nothing for any virus. If you get the flu, it's a virus. An antibiotic will not help that. Antibiotic is for bacteria only. So asking a physician or other healthcare provider for an antibiotic if you think you have COVID is completely worthless and a waste of a valuable resource. Let's talk about symptoms. It's just like the flu. Symptoms are very similar. Fever or chills. Some people never have any fever though. They may have symptoms other than that, or they may have no symptoms, but some people never run a fever. So you can't count on that being, oh God, this person has a fever, they were exposed to COVID, they have COVID. That's not true. Fever or chills, cough or sore throat, very similar to the flu. Nasal congestion or a runny nose. Shortness of breath or difficulty breathing because you have nasal congestion and chest congestion. Fatigue, muscle aches, body aches. If you've ever actually had the flu, you understand that your body hurts, you feel terrible, you feel like you've been hit by a truck. That fatigue, muscle, and body aches are part of the COVID symptoms as well. Severe headache, nausea, vomiting, and diarrhea. That wasn't an initial part of the symptoms. It was pretty much respiratory. But then we started seeing people coming in with nausea, vomiting, diarrhea, and tested positive for COVID. So it's a wide variety of symptoms, and some of them can be pretty vague. A new loss of sense of taste or smell. If you have an ailment already that affects your sense of smell, that's not the same thing. But if all of a sudden you can't smell anything or your sense of taste is altered, that may be a symptom that you have been exposed to COVID. Some people who get COVID never have any symptoms at all, and they are never aware that they have it. If you're not tested for COVID in the absence of symptoms, there's no way to know whether or not you had it or not. Southern University Shreveport has implemented strategies to reduce the spread of COVID. Dr. Pigas referred to that earlier, and they are doing a fantastic job getting the Southern University ready for return of students. There's signs posted throughout the facilities about hand washing, mask wearing, and social distancing. Everyone entering the facility will be screened for COVID-19 symptoms. Everyone entering the facility is required to wear a mask. That's correct, is it not, Dr. Pigas? That's correct. Excellent. Cleaning and disinfection of the facility has been ramped up to comply with the CDC guidelines. They're very specific. Southern University has those guidelines, and they are following them to the letter. Social distancing hasn't been implemented. Social distancing is very hard for Southern people. We're huggers, we're talkers, we like to get together and have a crawfish boil, we like to watch a ball game, and it is very difficult to social distance when you're gregarious Southern people. But it is vital to social distance in the absence of face masks every chance you get. Stay home if you're sick. Seems like an easy thing to do, but some people, we're gonna sally on. We're gonna come to work, and we're gonna come to school, and we can't miss school, and we can't miss work, and we don't want to let our coworkers down. We want to show up for work. Don't come to work if you're sick. Don't come to school if you're sick. You're exposing other people to whatever it is, whether it's COVID, the flu, a cold, whatever. Stay home if you start running a fever, have any symptoms. When everyone wears a mask, the droplets can't travel. It's just that simple. Yes, there's lots of stuff out in the media right now about, they're not really sure how it travels. The best science that the CDC and the World Health Organization can provide indicates that COVID-19 is transmitted by droplets, heavy droplets that fall to the ground soon after they're expelled from your body. Let's go with the science. Until we have better information, which is better science, which the CDC is always working on, we have to use the guidelines that they provide for us. Wash your hands using alcohol hand sanitizer or soap and water. Wash particularly after you have removed your mask to eat or drink and after you put your mask back on. And why is that? Because you handle it. Try not to handle your mask by the front. Try not to grab a hold of the front of the mask. This fabric is contaminated with whatever someone has sneezed, coughed in your direction. Not saying it's COVID, but try not to grab this by the face. If you're taking your mask on and off, use the loops. That way you're not touching whatever pathogens happen to be on the outside of your mask. Drop it using the ear loop. Wash your hands. You've handled a mask. There may be some contaminant on your mask. There may not, but wash your hands after you handle it, and you can be assured that mask, whatever's on that mask, is not on your fingers anymore. Social distance, it is vital. It really is. I know it's hard, but it is very, very important that we try to stay out of each other's faces during this crisis. What's wrong with these photographs? This is a friend of mine at Willis, Knighton. He was kind enough to pose for my pictures. In the photograph on the left, the mask is down below his nose. That's not doing anybody any good. You breathe in and out through both your nose and your mouth all the time. When you're talking, you're breathing in and out through your mouth. When you're not talking, you're usually breathing in and out through your nose. That's helping no one, wearing it like that. People say, and I hear this all the time, well, I can't breathe. Calm down and breathe through your mask. It is possible that no one would hand you a mask manufactured by a legitimate mask manufacturer that was going to keep you from breathing through your mask. It's not possible. So you can breathe through the mask. It is not holding in carbon dioxide. It is breathable to the point where tiny, tiny particles that make up air and oxygen and carbon dioxide do travel through the mask. But heavy droplets caused by COVID do not travel through that face mask. Don't wear it like that. Under the chin, that's my favorite. I love the chin protector. That's great. That's helping no one. I understand it's hot. You've been wearing it all day. People wear it like that so they can pull it up and down. Then you're handling it by the front of the mask. You're touching it when you're doing this with it. So take it off if you're not going to wear it by the loops, and this is not helpful to wear your mask like this. And you've seen I'm sure you've seen other people, it's up on top of their head. That's fun. Or it's dangling by one ear loop over here. You're still touching it. Got to wear your mask correctly. Cover your nose and your mouth, keeps the droplets out. When everyone wears their mask correctly, droplets can't travel. This is the correct position of your face mask or face covering. Cover your nose and your mouth. Make sure you got a decent seal right here over your nose so air doesn't come down behind it. Make sure it fits pretty good around your chin. Doesn't have to be airtight, but what you're trying to do is keep those droplets from entering under the mask, around the mask, over the top of the mask. Do you carpool to get to Southern University? If so, everyone in the car needs to have a mask on while you're carpooling. A lot of people carpool to work, carpool to school, got to have a mask on in the car. But if you're driving in your car alone, you don't have to have your mask on. You're all by yourself. You're 6 feet from other people. It's not mandatory to keep your mask on as you're driving down the road. Put your mask on as soon as you know that you're going to start interacting with other people. Let's talk about if you're exposed to COVID-19. First thing, let's try not to panic. Are you really exposed? Does your mama's sister, who she plays bunco with, have COVID, and you have not been around that person at all? So let's be sure you're exposed before there's any further information that you need to have about the COVID exposure. But you should stay home and self-quarantine for 14 days. I know that's very hard when you're in school. Very difficult to stay home for 14 days. Even if you have no symptoms, if you are truly exposed to COVID, you need to stay home and not interact with your other students and people at SUSLA. Check your temperature and go over the symptoms list a couple times a day. Morning and night, that's good. Make sure you're not running a fever. Make sure nothing new is going on with your body. You're not having the body aches, a bad headache. Just go over the short list of symptoms. If you get tested for COVID at any time during those 14 days and your test is negative, you still need to self-quarantine for 14 days. If you're exposed on a Monday, you get tested on Friday, you could still be positive anytime within that 14-day period. Generally speaking, COVID, after an exposure, you will, if you're going to get the virus, it's between 2 and 14 days. So not the day of that you were exposed to somebody. Getting tested that day or the next day is not helping you at all. It's not telling you whether you have COVID or whether you're going to get COVID. It doesn't help at all to get tested. I went to church on Sunday. Now my choir member has COVID. It's Monday. I'm going to go get tested. It might be negative. 2 days from now, it might be positive. So running out and getting tested too soon is not helpful to you or anyone else. Some people who have COVID never develop any symptoms. I think we talked about that already. Let's talk about some things you can do to avoid getting exposed. Don't share food and drinks. I think most people don't do that anymore, but on occasion, you know, somebody's got a nice dinner. Here, try this, it's delicious. Don't do that. Stay away from sharing food and drinks. Don't share pens and other items. Don't touch each other's phones. What do? We pick up our phone, look how cute this is, and we show them a picture of our kittens. Don't take someone's phone from them and look at their photographs. You're welcome to look at them, but don't take their phone. Everybody is touching their phone all day, every single day, and that phone is the primary place that a COVID virus would be resting for you to catch if you pick it up. Keep your phone in your pocket or in your purse. Don't leave it lying around on the desk for somebody to go, oh, here's your phone. Your phone is very, very personal to you. Don't share your phone. You know how to clean your phone? This is a little tricky, but take a cotton ball, soak it in alcohol, regular old rubbing alcohol. Squeeze it out till all the liquid is out. You don't want anything dripping from that cotton ball. Then you can scrub your phone front and back with that fairly dry cotton ball, and that will disinfect your phone of COVID, flu, rhinovirus, anything that might be on your phone. But don't spray your phone with any sort of disinfectant, and don't use a wet wipe to clean your phone. Our IT people talk to Apple about this, and that's how Apple recommends you clean your phone. You can do the same thing with a laptop, any other sort of portable electronic device. Cotton ball, squeeze the alcohol out of it, scrub it. Won't hurt it at all. Okay, let's talk about COVID and the flu. Flu season's coming, is it not? The symptoms are so similar that this is going to be very challenging in healthcare for the fall and as flu season ramps up. Both the flu and COVID are transmitted by droplets, so masks are vital. The mask will protect you from the flu as well as COVID. Will a flu shot help? Maybe. The CDC says it will. It won't keep you from getting COVID, but you don't want to get the flu and COVID because you're going to be really, really sick if you get both the flu and COVID. Plus, you're going to go, if you end up in the emergency room or a urgent care setting, they're not going to know whether you have the flu or COVID. They're going to test you. They're going to isolate you until they know one way or the other that you don't have COVID, and it's going to be a lot more intense visit than if you just thought you had the flu. But very sick if you get both COVID and the flu. While the flu shot is not 100% effective, I think we all know that. The flu shot's like a seatbelt. I wear a seatbelt when I drive down the road. If I have a wreck, I might get injured, but not nearly as bad as if I didn't have my seatbelt on. So look at the flu shot like that. It's like a seatbelt. Helps some, won't prevent 100% of the flu, won't keep you from getting sick, but if you do take the flu shot, your chances of having a much milder case of the flu is scientifically proven. Your duration of your flu will be shorter, your symptoms will be less severe, and wouldn't you rather have that little bit of protection on board so that if you do get COVID, maybe you won't be quite so sick if you have the flu and COVID. So please, please, please consider taking a flu vaccine. Got some resources for you. the CDC coronavirus. If you type that in Google, CDC coronavirus, CDC COVID-19, a myriad of information is going to pop up for you. Anything from when can I go back to work, how to make a face mask, what about my dog, you name it, it is on that CDC website. And all you have to do is type in what you're interested in, and much information will show up. There's a whole section on returning to school, returning to work. There's a whole section on protecting yourself. There's a whole section on food preparation and how you might want to isolate yourself from each other in the home if one of you have COVID and the other don't. So please take advantage of that CDC website. The Louisiana Office of Public Health also has a coronavirus website. It's very good information as well. And all of the return to school and work information for the state of Louisiana is located on that website. Coronavirus, this is what it looks like under the microscope. I appreciate your attention. I'll take any questions you might have.
Good morning.
Good morning.
My question was about the face shield. Is it an alternate for the mask, or what do you recommend? Some people wear the shield, some people wear the mask, some people wear both. What do you recommend?
In the healthcare setting, if you are interacting with an actual COVID patient, both are required. Out in the public, it is recommended that you wear a mask or face covering. It is not recommended that you wear a face shield instead of, but there are people who have things like COPD or asthma, that it really is a difficulty wearing a face mask all the time. So you might see somebody with just a face shield because they have some sort of respiratory ailment that is making wearing a mask difficult. But out in public, in your regular activities, during the day at work, the mask is what is recommended, not a face shield.
With phase 2 and 3, are visitors going to be allowed on campus?
I'm going to leave that to Dr. Pigas. That's not something that in healthcare that I'm addressing. I know that we have seriously curtailed visitors in the healthcare settings.
Good morning.
Good morning.
I was concerned about when the students change classes, walking the hallway and stuff. How will we social distance with that?
It's going to be very, very challenging. You know, you can walk through Walmart or Sam's and you're going to pass people in the hall. It can't be helped that you're not going to be able to sit in different sections when you're moving around the building. What we're going to try to do is keep people aware of social distancing, the hugging and the high-fiving that young people do and that all people in the South are always doing is very difficult to curtail.
Thank you.
You said something about the droplets, which was very informative. But can you roll down your window? I haven't rolled down my window since March. Absolutely,
roll down your window. Absolutely. In fact, when you're out of doors, you're much safer when you're outside. If you're at the park or your family's having a picnic, outside gatherings are much safer because the wind's blowing and the air is moving. When you're in the house, the air is going through your air conditioning system. And I'm not saying that it's full of COVID or anything, but gathering in a closed-in place is much less safe than outside. And now that the weather's lovely, I think we can get out a little bit and have some social activities as long as we do our best to practice social distancing, even in those settings, and wear your mask. But absolutely, outside's great. Roll your window down.
And to piggyback on that answer, here on campus we have social distance, the tables and chairs. You'll see that in the classrooms as in the auditoriums. The chairs that have stickers on them that says, for your safety, please provide extra space between yourselves. Even on the outdoors tables, we've spaced those as well. So we want to just be cognizant of our every move when we're transitioning between classes to keep our distance as well. It will be difficult, but as she says, when you're out shopping, sometimes you do pass right next to someone And that's the reason that we're wearing the mask as well. Any other questions? Well, on behalf of Chancellor Ellis, I want to thank our partner, Willis, Knighton, Ms. Stanford, for coming to address us, our Southern University Shreveport family, in reference to our safe return to campus. This video will be available online. We look forward to your return. And also, I want to make sure I thank Mrs. Rogers and her team, marketing team, for all of the efforts that they've done to make this a successful return to campus. Thank you, and look forward to seeing you.
Thank you.